Good morning, Spoonies. It's Dr. Julie. I had my surgery yesterday. It's been an okay so far recovery. My nausea's been a little difficult to control. My pain has been controlled, and trying to get my appetite and drinking as much water as I can. I have my little garment on. It was really easy to put on after my surgery in the recovery room. This is a large, and you can easily access my surgical wound or bra. Last night I had to check one of the sites, and I was able to fully expose it. So that was nice. I slept in the garment, and it was very comfortable. I'm actually sleeping on a recliner because they want me to stay up at 45 degrees. I did not have drains placed, so I'm not using the pockets. Thank you for all support. Talk soon. Bye. Hi, Spoonies. It's Dr. Julie. Day 2 today from my surgery. Just really working on the 5 rules of surgery. We call them the 5 W's when I was in training. And that's W for win. So we want to make sure that we take some deep breaths, either by sitting in a chair or walking. Next W is water, and making sure that we don't get a urinary tract infection. So hydration is key. A wound infection can develop, so making sure you take care of your dressings. You can't get some fevers from certain winter drugs or medications, antibiotics. Keep that in mind. And then probably one of the most important things is the W for walking, and that's making sure that we don't develop blood clots. So we do this by moving around, and sometimes they will prescribe this little compression device where you slip your leg through there, and it squeezes your calf, and that helps circulate your blood flow to prevent a clot from forming. Things are going well. I'm continuing to use my chest wrap, and that's working very well. It was very easy to take off and put a new one on after I took a shower today. Hope you guys are doing well. Bye. Hi, Spoonies. It's Dr. Julie. I'm day 4 today from my surgery. Things are going well. I finally feel like I got my appetite back today. Some of the things that were very helpful during this recovery is making a schedule for all the medications that I had to take, like what I had to take in the morning, afternoon, and evening. It's really surprising how much medicine you have to take between the pain medication, the antibiotics, the anti-nausea medication, and the supplements. So that was really helpful. The other thing is just really be patient with yourself. I have very little energy, and it takes a lot for me just to walk around the kitchen, but it's important to move around. Again, we want to prevent any clots from forming. I've also noticed that I do have a little bit of swelling, and that's not uncommon after surgery. You tend to retain water, which you tend to get rid of, about 72 hours plus. And so I've noticed that as well. The wrap has been fantastic. I really enjoy my Spoonie Threads wrap. It's been really helpful moving around the house in it and taking a shower. I was limited with my arms. The surgeon did not want me to use my shoulders or elevate my arms at all. And he really restricted that movement. And so if it wasn't for the wrap, I think it would be very difficult for me to put on a sweatshirt or a shirt because the wrap is so wide. I'm able to slip in and out, and that's been very, very useful. Constipation is also another thing I've been dealing with a little bit. So I am on a stool softener, and I am taking Miralax, but I think it's just something to keep in mind, and you may want to reach out to your doctor if that is something that you struggle with, especially after surgery. I started taking some probiotics today, and that seems to settle out my stomach as well. So lots of different moving parts, and they're all, it's all going to take time. So be patient with yourself and take care. Bye. Hi, Spoonie. This is Dr. Julie. I'm a week from my surgery. Still feeling very exhausted. My follow-up checkup went really well. Just still limited in my activities. Still not able to move my upper arms. Showering is probably the most difficult thing, and thankfully I've had my sister here to help me with that. Trying to maintain a high protein diet and cut back on the processed foods. Still really trying to hydrate myself. All in all, things are going as they should. I hope you guys are doing well. Bye. Good morning, Spoonies. This is Dr. Julie. I am now day 9 from my surgery. Today is a much better day. I'm feeling a little bit more energy, got a good night's sleep. So yeah, I think I'm headed in the right direction. I wanted to show you guys a little bit of kind of what I'm doing, I guess, and give you guys some ideas. Hopefully this will help. So these are some of the protein bars that I use, some pecans. I also have pistachios to help with the protein intake. This is my water bottle, and it's 32 ounces, and I take 2 of these a day. It's hard for me to drink water, so I flavor it. This is just a liquid IV flavoring that I use. These are my medicines, and I kind of have it arranged like this is what I take in the morning. This is what I take in the afternoon. This is what I take at night, and some of my other supplements that I take. So it's a lot, and again, trying to figure out a way for you to organize is really important to help you remember what you need to take. I hope this helps. Hi, Spoonie. This is Dr. Julie again. One of the things that I really found very helpful with the garment is really the pockets. Again, I didn't have drains placed, so that was a blessing. But I found that the pockets were very useful to put my snacks in, any medication that I may need, remote control. They were pretty wide, and it really helped me not to have to get up as often and not have to rely on someone to get me a snack or the remote control. So I found the pockets really useful for other things other than drains. It's still very important for you to move around, but like I said, I personally was not expecting to be in as much pain as I was. But I'm day 9 now, and things are going well. Talk to you guys soon. Bye.